And what I want to do on this day, Jason, is I want to go back to first principles. Our Jennifer Jacobs reports that someone at the White House is gravely, gravely ill, the head of security for the White House, CREDE Bailey. If somebody is young and gets the virus, I guess it's not a big deal, whether in the United Kingdom, in the United States, or in India. But what is the probabilistic idea there towards older, more fragile people?
Yeah, well, good morning, Tom. When we see cases in children, they are often, and younger people, they're often the potential sources of infection in older adults. And as every decade of life increases over the age of 50, we see this exponential rise in the probability of both hospitalization, mechanical ventilation, as well as mortality. So as one ages beyond 50, particularly in the upper ages, 70s and 80s, we see a dramatic increase in the likelihood of severe illness and death.
But Jason, for the record, we've seen a number of deaths of, also healthy individuals in their 30s and 40s that were, very unlucky with the virus. So what do we know about, in certain people it creates a perfect storm where they just can't recover from it. Why does that happen in certain individuals and not in others?
It's a great question, and we're looking at that from a variety of different immunologic perspectives, basically looking to see at various receptors on cells, what receptors might influence replication, allow the entry of the virus into lung tissue and other tissue, and ultimately lead us to greater infection. For example, we have seen the number of ACE2 receptor sites in the nose, and therefore allowing people to increase the amount of virus they're exposed to, increase with age. Now, in some younger people, their immune system may be so completely naive to this infection, meaning they've never really experienced other forms of coronavirus. They get exposed to this form of coronavirus, and there's an immunologic, loss of control, the cytokine storm. And so they respond so briskly that it overwhelms the system.
Jason, who, people in the street are mainly sometimes fed up of the extra restrictions, but who do they listen to? So a president of the United States that said, this is nothing more than the flu, people can get over it, let's get back to business. Does it change the way people behave, or do they still listen to the scientists?
Well, I think there is a dichotomy of thought now in the country that is unfortunately politically polarized. And the president does everything in his power to ensure that that remains the case. Let's be clear, we are not certain the exact clinical levels of care that the president received, but I am certain that based on the description given to us by his White House physicians, they went well above and beyond what you or I would receive in a U.S. hospital. They did not follow the NIH treatment guidelines. The president did not require continuous supplemental oxygen, and therefore did not qualify for the need for the dexamethasone steroid. The president also was not severely ill, according to his physicians, and therefore may not have qualified if he were in many facilities around the country for the remdesivir. Certainly, the final thing is that the patient was discharged, the president was discharged before stopping either of those drugs, and the NIH guidelines recommended that you continue those drugs for 5 days or until the time of hospital discharge and not beyond. Now, in his case, he took a hospital basically back to the White House with him so he could get back to work, which is a unique scenario. So when we think about what the president said versus what we know, we don't have all the information to conclude any facts from the president at this point.